Hi, everyone, and thank you so much for attending our XMAP Virtual Connect meeting. We hope that a lot of the presentations today were very fruitful and edifying towards your research needs. I am joined live with several great speakers here today. On behalf of Dr. Charles J. Rosser, who is the founder of Nonagen Bioscience, we have Hideki Furio, and we also have Dr. Jason Hinman, who's the founder of Sage Cerebro Diagnostics, who gave a talk today on the multiplex immunoassay for vascular brain injury. Mr. Thomas Martins, who's our senior research scientist of ARUP Laboratories, who discussed the clinical utility for cytokine testing. Dr. Sherry Dunbar, who is our senior director of scientific affairs of Luminex, who gave the last year's recap of our XMAP technology. Dr. Stephen Angeloni, who's our senior fields application scientist from Luminex, also gave a discussion on precision coupling for determining antibody titers and screening antibody specificity. I'm also joined today by my colleagues, Dominic and Andrada, the senior marketing manager for scientific applications and collaborations, and Dr. Jackie Surls, who is the director of Luminex's Explorer Labs for customization of assays that you may be interested in doing. So you have an opportunity to ask questions to any of our speakers today. We are not joined, unfortunately, with a couple of speakers who presented. I just want to mention their names and just tell them thank you, which is Dr. Lin Guo and Jay Overholser of Ohio State, who gave a presentation on combination immunotherapy and peptide vaccinations targeting PD-L1. Also, Dr. Resmi Ravindran of UC Davis, who discussed on the evaluation of a bead-based multiplex SARS-CoV-2 neutralization assay. And I think that is really it. So you have an opportunity to fire away with any questions you may have in the chat window. If you also want to vocalize your questions, feel free to do so. And I can go ahead and get the ball rolling. We were given already a couple of questions in advance by a couple of attendees who were not able to attend. So the first question is for Jason. Jason, the question that was being asked here is that regarding the vascular brain injury is the test supposed to be given once the brain injury occurs, or do you do any either pre or post screening? Jason, are you there by any chance?
There we go. A little trouble with the audio. Can you hear me, Bobby?
Yes, we can hear you.
Okay, great. Yeah, so it's a really insightful question. And the answer is that the way we envision this test being utilized is as a screening tool to help providers and or patients recognize their risk in advance of, let's say, a cerebrovascular event like a stroke or in advance of vascular brain injury related cognitive impairment. So we view it as a tool that would be utilized multiple times per year in at-risk patients, and hopefully be amenable to sort of applying a quantitative measure to the assessment of one's cerebrovascular risk. Great question.
There was another question that was given to us earlier. This question is for Tom at ARUP. Tom, the question that was asked here is interesting, and it's a very popular topic these days, and it's about matrix effect, and it was also discussing here about heterophilic antibodies. What is your take on some of the off-the-shelf RUO kits in regarding to matrix effect? And what is maybe the advice that you would give for those who are taking RUO kits and taking them as LDTs?
Yeah, great question. I think, my presentation, I covered the heterophile interference quite a bit and what we've done to mitigate that. I worked with some, as you said, commercial off-the-shelf kits. It's not always clear what you're doing for heterophile interference in those, how they're eliminating that. It's in the diluent or other things. A lot of the formulations are usually proprietary, so I can't really comment on what they're doing. But from our studies, yeah, definitely heterophile antibodies are quite evident, still around, and still have huge impacts on these damage capture type assays where we're using, extensive amount of monoclonal antibodies, both mouse and rat. Is there more to the question?
Yes, and because I think someone was also very interested about the LDT portion of it, because I think there's no guidelines to how you would take those RUO kits, in terms of validation and correlation studies.
Yeah.
So I was wondering if you have an opinion about.
Yeah, so if we were going to offer a RU assay for clinical testing here at ARUP, we'd take it through the same validation process as the LDT. We'd pretty much treat it as LDT. So all the performance parameters I discussed in my talk, we would do those for any RUO assays or research use only assays.
Right. Dominic, do we have any questions in the chat? I think there's one, right?
Sure. Actually, there's one that I saw as far as regarding the talk on bead coupling. Is there an ideal starting concentration for coupling carbohydrate antigens onto the bead?
Okay, that question's for Stephen, right?
I believe so.
So can you all hear me?
Yeah, Stephen, we can hear you.
Yeah. Yeah, so the carbohydrate coupling is a little more complicated. You can't always use our standard carbodiamide coupling, but the cookbook has a couple of other alternative chemistries you can use. And in general, if you're going to be binding these things again to, our raw carboxyl beads, again, you should keep in mind some of the things I mentioned about the coating level. And for the carbohydrates, because you can't really pin a molecular weight on them, you're going to have to use the microgram per million beads kind of coating level calculations. And generally, we know that something that's as large as, say, an IgG molecule pretty much saturates our bead surface at about 5 micrograms or 3.5 micrograms per million beads. And if your carbohydrate, if you see your carbohydrate prep on a gel and it has some kind of smear and it's in a certain molecular weight range, you can still work on that assumption of, say, like 3 to 5 micrograms of carbohydrate per million beads could be saturating. And you'll want to test, different coating levels, probably starting at about 3 micrograms per million beads, and then try a couple lower ones and see which ones of those work the best to give you the best specificity with not as much background and cross-reactivity. That's the best thing you can do with those carbohydrate antigens if they have no protein or amines in them. If they have amines and stuff, amine residues in them, then you can do the direct coupling. If you do have more questions, though, reach out to us, and then we can talk to you in more detail about what you want to do and the type of antigens you want to couple. And I see on my end here, I'm seeing a few questions about how to get some of those workbooks. And I'll put a few links in the chat here that I'm getting so people can grab those workbooks. Or you can actually call me because there's some that I've had a few modifications to them. So if you want the latest, you can reach out to me as well.
And Steve, there's another one that I saw as far as in the chat regarding the bead coupling. For selecting bead regions for, say, a 30-plex, is there a strategy for spreading out the regions, or does it make any difference?
Yeah, it really doesn't make a difference because the definition of the bead regions is pretty precise. We've had I've worked with a client, they have a 200-plex bead, set. And, you can't spread them out too far, 200 beads out of 500. And there are some that are really sequential in the lineup as far as bead IDs and their numbers. So you really don't have to worry about that, as much. But if you want to, depending on which instrument you have, if you have our 3D or iFlex, which can read all 500 bead regions, you can spread them out like 2 or 3 bead regions apart if you want to for your 30-plex. But again, get in touch with us so we can see what you want to do, which instrument you have, and come up with the best strategy to put that assay together.
I see another question actually for Dr. Rosser's presentation. It's asking, did the marker levels also help with indicating severity of cancer or if the cancer was metastatic?
That's good questions. So based on the 10 biomarkers, so far that we cannot distinguish if it is metastatic or that we can tell the grade or even the stage. So currently we can just tell with or without cancer.
Okay. I see another question for Steve. What's the range or size of antigen that can be coupled to the beads?
Okay, yeah, well, we've coupled some pretty large molecules to the bead. I think the largest thing I've coupled is an IgM molecule, which is almost 9,000 Daltons. Again, that's the biggest molecule I've known. And because it's made of a multimer that's all covalently linked, that should be that would be fine. But you can have problems if you're coupling proteins that are multimers directly to the beads, because they're not necessarily always covalently linked to the subunits. And you can have problems with some of those subunits floating away. So for example, I think a good example of that would be when people couple virus particles to the bead. Okay, that's essentially a big glob of protein. Okay, that's all virus code, which can be probably really huge. And what happens in that situation is not all of the subunits of that virus particle are covalently linked to the bead surface. So over time, some of those things fall apart, and whatever's not coupled, floats away, and you can see the MFI values decrease over time. And a lot of the users that do that kind of thing with something as large as a virus particle, they tell me that sometimes their bead preps have to mature, where they keep, losing stuff until they stabilize, where the only stuff on the bead is what's covalently coupled. So that's the best I can tell you for that situation.
Also, too, in that situation, while you're waiting for things to stabilize, it's best to keep your bead sets separate. Like, don't put them all together in a multiplex mixture, because as things fall off, they can go and stick to the wrong bead set. So I know that Steve and I both have had helped customers with that.
Sherry, there's another question I see here regarding an article that you discussed, or regarding the autism spectrum disorder. The question is asking is it fairly easy to prepare samples from dried blood spots? Is there a universal protocol that you would suggest that would be able to detect various cytokine and chemokine markers in DBS?
Yeah, so a couple things. In that specific paper, they simply took the 3mm punches and put them in the wells. And then when they were ready to run the assay, they just eluted them with 200 microliters of assay buffer, on a shaker at 4 degrees overnight. And then they just drew from that to go to their assay. But I would say, just from a lot of experience that we have in our some of the labs, like the labs that do newborn screening have experience with dried blood spots, is that it's always important to follow the stringent cleaning routine, routinely or periodically, because those little fibers that make it through the 200 micron sample probe can build up over time. And so there is actually a protocol and some recommendations in our XMAP assay development cookbook, which is on our website for download. And it's actually on page 81. And it's got a couple of different recommendations, as well as references for assays using dried blood spots on the XMAP platforms.
Okay. I actually want to apologize on behalf of Dr. Rosser. I actually failed to mention the presentation that he discussed at La Jolla, which was a novel multiplex test to detect and predict monitor bladder cancer. So I apologize for not mentioning that in the beginning. There's a question that's related to the presentation. The question is asking about the Oncuria test. Is it a rule out test for just specifically protein biomarkers, or do you also include molecular genomic targets too?
In this assay, no, we just included the protein.
Okay.
I see another question actually related to the bead coupling. I guess this is for Steve. Could you talk more about people or scientists that want to couple large plex sizes? If there's anything to do as far as the bead regions or any particular chapters maybe that can help them. They're looking to just work what resources and what things do they need to watch out for coupling, especially large sets.
Yeah, so that scale up is going to be dependent on your tracking for the small scale testing. Literally, sort of ratios you do at every step, including how much EDC you activated per million beads initially, which some of the newer workbooks I'm working on take that into consideration, because you want to keep all this stuff kind of stoichiometrically equivalent when you're going from, say, a small scale testing of 2 million beads or 5 million beads up to hundreds of millions of beads. And then the other thing that's key is that when you start working with these much larger bead concentrations, one of the dangers of sticking to what we do in the cookbook to go up to like 600 million beads is you're doing that all in a volume at the bead coupling step of about 2 mLs. And what happens at 200 million beads is that slurry is so thick that if you're adding to that reaction, say 100 microliters of your protein, and it's not at a saturating level, that bead slurry is so thick that if you shoot 100 microliters in there, there's probably little chance that it's going to get mixed quick enough so that 100 microliters can get mixed around in there enough to get an even distribution of that subsaturating level of the protein on all the beads. So by keeping some of these stoichiometries consistent with regards to all the reactive components, when you're going, say, up to the 100 million scales from the small scale, you can actually start to increase the volumes of your beads and your protein dilution. So they're more equal in volumes and the beads are more spread out. So you can mix them more evenly to hopefully get an even coating level of that protein or whatever molecule you're putting on the bead. So this is one of the things I advise people when they're doing their scale up, depending on that coating level they're trying to achieve from the small scale going up to the large scale. And again, I would ask you to reach out to us so we can work with you to optimize that process.
I would just add that you don't want to scale up the volume of the coupling reaction proportionately. So, if you're used to coupling in 2 mils and now you have 10 times more beads, you don't want to go up to 20 mils. You want to keep it as concentrated as you can, but you want to ensure that you have really good mixing during that coupling. And so I know that in-house we had done, as we got to some of those higher concentrations that Steve was talking about, we had some tubes that we were, doing like 4 mil couplings. But it's really key is getting good mixing in as small volume as you can, get the good mixing in.
Yeah, but that coating level is also important if you're subsaturating or saturating. So reach out to us if you have any questions. I actually put my email address in the link there for somebody who wanted more information on the workbooks. So yeah, we'd be glad to help you.
Any other questions from the group?
There's one that came in as far as for the ARUP labs. Did CAP or any other group help to plan out your revalidation tests, or revalidating your tests is what it says?
No, we follow CLSI and some CAP guidelines, but yeah, no, they do not directly help with as far as what needs to go on a validation. That's all decided and done here based on different guidelines.
Jackie, there's a question for you. They're asking, actually, she's asking, are there different types of services offered through the Luminex Explore Labs?
Yes, so we can do assay development services. So what that can entail is helping you develop your assay from the ground up. and helping you take it, all the way through that, validation, and helping you do your bead couplings and all of that for research use. We can also help you do sample testing as well, where you would provide us your samples and we can provide you that sample testing as well. And let's say you've also developed your assay and you would like us to couple those beads for you. So we do that routinely for some of our partners as well. So we can do that at any size and scale, where you would provide us your antibodies and proteins. And some of our customers, their materials are proprietary, and so they would send that to us and we would couple it onto our bead. So those are some of our services, and if there's something that is of interest to you and you want to speak to us about that, you can contact us at Luminex Explorer Lab at luminexcorp.com.
Thanks, Jackie. Any other remaining questions that we're more than happy to address for any of our speakers today? Okay. Well, first of all, I want to thank each and every one of our speakers for your dedicated time at La Jolla, California, for a great XMAP Connect meeting that we had back in November, and for your dedicated time today to connect with some of our attendees virtually. On behalf of Luminex, we appreciate all the people who are able to spend their time listening to some of these great talks. We are going to have a in-person XMAP Connect meeting held in, I think, around the Atlanta region, and it's going to be sometime in early November, so stay tuned for more details. If there's any other questions that you may have, feel free to reach out to me. My email address is bbatia@luminexcorp.com. You can also reach us through our technical support team. That is support@luminexcorp.com. If there's any other questions, we are more than happy to help address some of the problems that you may have, and hopefully XMAP is going to solve some of those problems. So thank you to the speakers, thank you to the attendees. We really appreciate your time today. Stay safe and enjoy the rest of your day. Thank you.
Thanks. Bye, everyone.
Thank you.